ladies and gentlemen. Thank you for visiting us at VATV on Comcast Channel 9 or RCN Channel 15. Tonight we have a special guest. It's Beth Baker. Welcome, Beth.
Hi, thank you.
Beth is the Director of Health Access and Wellness Services from our Boston Public Health Commission, correct?
Yes.
All right. So during our conversation, if you have any questions, please call in at 617-708-3290. So welcome, Beth. Tell us a little bit about your job.
Sure. So I am the Director of Health Access and Wellness Services, and I oversee the Mayor's Healthline. And the Mayor's Healthline is a program at the Boston Public Health Commission. We're a resource and referral line, a social and health service referral line. We're free, we're confidential. Anyone can call. We mostly serve folks in Boston, but people can call from around the state and we'll help direct them to make sure that they get the services that they need.
Okay, so when you say services, so is it predominantly just health or Medicaid, Medicare, dental, things like that,
Sure.
Insurance?
Yeah. So the list probably goes on really long, but I'll sort of the highlights of what we do. So health insurance for sure, Mass Health, which is Medicaid, Massachusetts version of Medicaid, Medicare, so for people who are over 65 or disabled. We have 2 Shine counselors on staff, and they are experts in that. We help people apply for SNAP benefits, food benefits, and mostly, the Mass Health applications, redeterminations. We also help people find primary care or health, health services, where to go to find a dentist, and if you need help paying for your dental work, we help with that. So,
fantastic. What about medication?
Medication, yep. So there are services and different programs that help people who can't afford their medication, and we try to find those for people. And sometimes it's a case of people need health insurance, right? Because often the health insurance will cover medications, but there are some cases where people, even with their health insurance, can't afford the medication, and there are programs out there to help people to cover those costs. So we try to connect them when possible.
Good. So our community, our patrons that are watching and listening, they're predominantly Vietnamese American, and some have a language barrier. So when they call you guys or come to talk to you, is there a translator? Are there bilingual forms, ways to help them with a language barrier?
So on staff, we have 8 people, and they speak 6 languages. Unfortunately, one of the languages is not Vietnamese. We do have access to a language line, so that helps that we can call in and we can get someone immediately to act as a translator. We also have a partnership with the Vietnamese American Civic Association. So if someone needs help and it's a little bit more complex, and sometimes having that language line just isn't enough, we can always refer them to the Vietnamese American Civic Association.
Very good. That's fantastic. So tell me, when you say assisting people with health insurance and Mass Health, is it just matters of helping them fill out the forms or knowing their eligibility?
Sure.
I think that's a difficulty for some people.
Yeah, it's confusing, right? People sometimes ask me what benefits I have with my health insurance. I'm like, I don't always know. So it's really confusing, and we understand that. And the language is hard to understand, even if you speak English as your first language. So we help people through the whole process, from figuring out the application process and walking them through the application process, because that alone, you answer one question incorrectly, and it can impact the determination that you get as far as health insurance goes. So we help people make sure that they fill it out correctly. And then once they fill it out correctly, they may be determined eligible for Mass Health, but they may be determined eligible for a health insurance plan through the connector. So helping them, that opens up other options. So is it, what insurance carrier do you want? Are you going with BMC HealthNet? Are you going with Fallon? Or, so trying to decide which one makes sense for you and the unique health needs of your family, and also financially, which one can you afford? Because obviously that's a big piece of it. And also looking at what benefits do you need? What coverage do you need? Who does your doctor accept as far as health insurance carriers? So does your doctor accept neighborhood health plans? So helping people sort of walk through that process and making sure that they know to make a payment if they need to make a payment, and how do you make a payment. And we found that a lot of people have difficulty filling out the online application. If you're not computer savvy or you're not used to using a computer, it can be really difficult. So we help people with the online application and completing it with them.
Oh, fantastic. So when you say you help them, is it more of the phone or in person?
In person or over the phone. We also do outreach events in the community, so we try to meet people where they are. Coming into our office isn't convenient for everyone. So we do events in the community, but we have walk-in hours. People can come in. They don't have to schedule an appointment, and we'll help them in our office and actually complete the application with them in our office, either online or there are paper applications if someone's more comfortable with that.
Good. So is there an open enrollment period?
So for unsubsidized coverage and some subsidized coverage, there is an open enrollment period, and that's the time when anyone can shop for health insurance. And that time is typically from November to February. And so that time is really important, especially if you're not happy with your health insurance and you want to change. That's an important time to know about, because that's when you need to make the change. You can't make the change at any other time during the year. For people who are on Mass Health, who receive Mass Health benefits, they can apply at any time. So they don't have to worry about open enrollment. We've had clients who come in and say, I don't have health insurance, but I know I have to wait until open enrollment. And we say, well, let's back up a little bit, and do you qualify for Mass Health? Because if you do, you don't have to wait for that November date to come by and then enroll then.
So you say Mass Health is there's no time, a deadline for the open enrollment. But what if someone does miss the enrollment period? Are they not covered for the rest of the year, or is there something that they could do?
So it depends. It's never straightforward, right? So call our office if you're not sure. It's better to find out about someone's personal situation. But they're called qualifying life events. So say you are working and you, through your employer, you have health insurance, and then, let's just say it's April, and you lose your job, so you lose your health insurance. That's called a qualifying event. So if that happens, it's okay. You can apply outside of open enrollment, or if you have a child, or if you get a divorce, so you lose your health insurance through your partner, you can apply for health insurance then. And there are other qualifying events, but those are some of the more common that occur to people.
Okay. So you want people to reach out to you no matter if they have a job and their HR is helping them with open enrollment, even that you still, if they have any questions, to still reach out.
We can definitely be helpful. It depends, because it may be that what your work offers you is not a plan that's in the health exchange, so we may not be familiar with it, but we can at least talk to people about what should you consider when thinking about what plan you're going to take from your employer, and we'll help anyone. I mean, again, you can call from a different part of the state. It could just be that you work in Boston, so our office is convenient, or we have the language capacity that you're looking for, and so we'll help you.
Good. So you keep saying our office. Where is your office located?
Oh, yeah, that's a good question. So we're at 1010 Mass Ave, and in Boston, because sometimes we have people, they end up in Cambridge thinking 1010 Mass Ave in Cambridge. So we're near Boston Medical Center and the South Bay Shopping Plaza, in between the two on Mass Ave.
Oh, okay. So right by the New Market Square area.
Yep.
Awesome. So for Mass Health, there's a redetermination process and a renewal process. Can you tell us a little bit more about that?
Yeah, so every year, anyone who's on Mass Health needs to be redetermined, and all that means is that they have to look at you and your income, your family size, and see if you still qualify for Mass Health. Not everyone qualifies for Mass Health. You have to meet certain income criteria. And there are other factors that they look at, but income is probably the biggest one. So every year they do that. For the past 2 years, because of glitches in the system, that wasn't happening. People who are familiar with Mass Health, didn't go through that redetermination period, and we're probably wondering, what's going on. Someone who's not familiar with Mass Health doesn't even know that happens, right? So now they started doing it again. They started up with the redetermination period this past January, and they're doing it until December, and then it will continue sort of on schedule again yearly. So people should be looking at their mail. I know sometimes I'm guilty of not reading my mail or like seeing something and assuming it's junk mail, but if you have Mass Health, open your mail, read it. Sometimes it's confusing what it says, and I've been in that position too, like I don't know what this says, so I throw it aside, like I'll go back to it. Don't do that. Your benefits will be dropped. So for folks who are familiar with it, the redetermination process is you're filling out an application again, essentially. So then they're able to screen you and see, do you still meet the criteria? So the big takeaways are just make sure you're reading your mail. If you're on Mass Health or you're unsure if you're on Mass Health, just call us and we can help you to figure out whether or not you have to complete a new application.
Okay. So for, I guess, the difficulties of when you're kind of in between that, if you drop from Mass Health and didn't get to that reapplication process yet, how do you deal with that short term of not, if you needed medical help and didn't?
I mean, definitely go and seek out medical help. I mean, never feel like I don't have health insurance, I shouldn't. You know, if you have an emergency, go to the hospital. And that being said, you know, once you realize you don't have Mass Health, just come in as soon as you figure it out. We'll complete a new application. A lot of times it's retroactive by like 10 days. But I know, again, that sometimes people's instinct or just what you fall to is, I don't have it, just whatever, and don't want to deal with it. It happens to people all the time. We can help you. We'll fill out the application. It's easy. It's not any more difficult to complete an application because you've lost Mass Health. It's the same application process. And it really, it takes at the most an hour. And I know sometimes it's hard for people to come in. We're typically open 9 o'clock to 5 o'clock. But if you call and you make an appointment, we can vary those hours. We can come in a little bit earlier, like at 8 to meet someone.
That's great, because they're so flexible.
Yeah, we want to be as accessible as possible. And we know people work different hours and different shifts. And we just want to make sure that people get these services.
So you said your staff, your team members speak 6 different languages?
Yes.
Tell us what languages.
Okay, so let's see if I can get all this. So English, Spanish, French, Haitian Creole, Cape Verde Creole, and Portuguese.
Oh, fantastic. And I guess for me, I know that especially with health insurance and medical stuff, it's a little private. So, and I need to really trust the people that I'm talking to, and that's helping me with it. So tell me a little bit about your team's background.
Sure,
and expertise.
I mean, we have people on our team who have been helping people with health insurance for 15 plus years. The Mayor's Healthline has been helping people complete applications for health insurance for over 25 years. So there's definitely an institutional knowledge, and all of the folks on the staff are trained as navigators, so that means they've gone through dozens of hours of training to assist people and help them complete the application. We also go to quarterly trainings. There's always online trainings. I mean, it's very complicated, and that's not to say we know everything, but we'll find the answers if we don't have it for people. Also, the organization's HIPAA compliant, so that just means, for people who don't know what that means, the privacy. If you share something with us, it doesn't leave our office. It doesn't leave that conversation. I mean, unless you give us permission to, because we have to get additional information. We have to share that information to get more info for you. And people should feel safe. Immigration status, we're not in the business of reporting people. So that's
just going to go there. You were reading my mind, especially. Yes, immigration, but maybe even students with visas or just young adults, really, who aren't sure if they're still covered under their parents or they have to purchase their own.
Right. We want to help people, and we don't want people to be afraid that they're somehow going to get in trouble by coming to our office. That's not why we're a program, and that's not our responsibility. So people shouldn't worry about immigration status. They should come to our office, and we'll help them as much as we'd help anyone else.
Awesome. So just to kind of I am losing my thought process. So definitely mass health questions, definitely the health connector questions.
Yes.
And then you said, so for insurance wise, you can refer them to the different insurance agencies, the different insurance companies. But I guess tell me, how are there any advantages to who they pick for you guys?
Sure. So going through us, what happens is if you complete an online application, just walking through it, you would fill out all your information. You find out you're eligible for a connector care plan. Those are the plans through the state, the exchange.
Yep.
And the different carriers will come up. Let's just say it's BMC HealthNet, Minuteman, Neighborhood Health Plan. So they all come up, and then we help people among those plans choose one.
Okay.
So we are not allowed to say like this one's
Okay.
better than that
Okay,
one.
right.
I've gone through my navigator training. I would never do that. But we can say, well, who does your provider accept? So sometimes what we'll do is we'll call, your primary care provider and say, and they'll know. I mean, you don't have to worry. They know. So you call your primary care provider, and we do it with people all the time, and say, who of these insurance carriers do you accept? Do you accept the Neighborhood Health Plan? Do you accept Minuteman Health? And then, so that helps to sort of narrow down the pool, because not every doctor takes every health insurance, right? And then a lot of it comes down to money. How much do the plans cost? Because sometimes there will be big differences in what the premium is. And then sometimes it will be what else, like what other services they cover. And sometimes it's where you live even, because there might be more access to doctors and specialists with a certain plan in a certain area than another plan.
Where their headquarters are and things like that. So are there any specific experiences that you've seen that would help the community on, just an out of left field questions that you've encountered?
I'm trying to think of, I always say to people, like, don't be afraid to ask, because if you haven't, we've probably heard the question. If you haven't heard it, we're going to hear it in the future, right? So people shouldn't be afraid to say, what am I doing? Like, one of the things that people need when they apply for health or when they apply online is an email address. Well, not everyone has an email address. So even helping people to create an email address can be a process, and people can sort of be skeptical of a system that requires that. So I don't know if there are any...
Actually, that brings me to a point. What do people need to bring?
Oh, yeah, good question. So people need to bring... They need their social security number if they have one.
Okay.
Social security numbers for everyone who's applying for health insurance. Okay. So if it's a mom and she's applying for her kids, to bring the social security dates of birth for family members who are applying, all of the names and how they're spelled correctly. And sometimes it's how it appears. Sometimes names can sort of change over time. But it's how it appears on legal documents, how it appears on your social security card. So having that information, income information. So how much did you make? How much do you anticipate you're going to be making in the next year?
Do they have to bring any validation with that, or does the application process go through the IRS and check? Right.
So when you complete an online application, they are able to make data matches with the federal hub. I'm not a computer person, so what does that really mean? I don't know. Magic is happening as you're typing in your information. But sometimes they're able to make a data match. So let's just say we complete an application for you online. We say who your employer is. We say how much your income is. And most of the time they're able to make a match for you based on like what they see with the IRS. Sometimes they're not able to. For whatever reason. We found a lot of times if someone has moved recently, especially if someone's moved from out of state to in-state, or someone just got a new job, the system's not able to make that data match. You're still able to proceed with the application. Just at the end it will say we need proof of your income. So you send pay stub, you send a bank statement, whatever it is, but it's very straightforward. And I think that's actually a question we get a lot, even with the online application. It needs to be able to prove who you are, or needs to be able to find some data match to say like you're a real person and you exist.
Yeah.
And sometimes people aren't able to get through that process, and they're like, did I do something wrong? And they're worried, does this mean I won't be able to get health insurance? And again, it's because they've moved recently, or maybe they just got married, or there's something that they're sort of like new to the system in the sense that they've had this change in their life.
Yeah.
So people should not worry about that, because we have it happen all the time.
Good.
And people get stressed out, but they shouldn't be.
What is the timeline process? So you said, either call you, make an appointment, walk in, come, and then application process is about an hour, and they might have to verify income, verify proof of identity. But after all that, what is the timeline that they'll get a health insurance card? Or
Yeah. So we encourage, and the state encourages everyone to apply online if you can.
Okay.
So when possible, and obviously there are circumstances that don't allow it, and that's okay. Apply. If it needs to be a paper application, better to do it than to not do it. But with the online application, you get real-time eligibility. So you're finding out right away, this is what you're eligible for.
Okay.
These are the plans. You choose the plan.
Yep.
And then you make a payment. So if you apply before the 23rd of the month, and you qualify and whatever else, and you make your payment, the 23rd is the magic date every month.
Why is it the magic date?
They just chose that as like the payment
okay.
date. Yeah, so that's when every month. So I guess it keeps it easy for people too, instead of having different dates each month. So as long as you pay, you then have insurance the first of the following month.
Oh, I see. So so after I'm determined and then pay, then my first doctor's appointment can be the first.
Yeah,
of the next
month. So you have insurance the first of that month, that following month. And with Mass Health, it's a little bit different, and you often get like real-time eligibility, and you have coverage then, or even sometimes going back like 10 days.
Oh, like you said, yep.
But yeah, I mean, it's fast, and again, that's why the online application is better in many ways, because if you complete a paper application, that then has to go into the system. It needs to be entered into the system, and it's not just magically being entered into the system, it's human beings entering that taking the paper application.
Entry.
And then it's, okay, maybe they can't prove you are who you say you are, so they're then saying to you, send these documents. So it's a much longer process versus you sit down in an hour, you know what you qualify for, you can pick a plan. Sometimes people, they see what they qualify for, they find out they qualify for these 3 different plans, and they want to go home and think about it. Totally makes sense. It's a big decision, right? Or you can't get through to your doctor, so you don't know what they accept. So people can log back in, come back to our office, and choose a plan, a week later, 2 weeks later, whatever works for them.
So we have just about a minute left, and just to review with our viewers, tell them how they can reach you, a phone number, a website, and of course the address again.
So address 1010 Massachusetts Avenue. Again, it's right near Boston Medical Center in the South Bay Shopping Plaza, Newmarket Square. People can call us. Our phone number is 617-534-5050. The website is bphc.org. And you can find information about the Mayor's Healthline there. But just my advice to everyone is call. If you're not sure, call. Just call, and it's better to put your mind to ease.
Awesome. With the phone number again?
617-534-5050.
Fantastic. Thank you, Beth, so much for joining us and educating us tonight. Everybody, please call if you have any health insurance questions. Thank you. Have a good night.